Okay, so this is probably the 6th time trying to make a video to put on YouTube, but this is so important to me, I want to get it right. Hi, my name is Joseph Reed, and I've got some important information to give to you in regards to mental health care in the state of Michigan. Please listen all the way through it because it will affect people you love and care about. So, in 1989, there were rules set up by the LARA, and the LARA is the Licensing and Regulatory Affairs Department in Michigan. And basically these rules govern how LPCs or licensed professional counselors do their job. And in this wording of this regulation, it was very unclear about the limitations that were put on these LPCs. So for the last, 20 years? 30 years? Wow. LPCs have been diagnosing mental illness. They have been treating psychotherapy. They have been suggesting medications to primary care physicians. All of these things which break the rules. There's a meeting this week on October 4th at the LARA department in Lansing, Michigan to discuss rewording this regulation, preventing LPCs from being able to diagnose, from being able to utilize psychotherapy. Now, psychotherapy it's a fancy word, but it does things that we deal with, I deal with every day. EMDR, cognitive behavioral therapy, CBT, dialectical behavioral therapy, anger management. This is really putting a lot of restrictions on the LPCs, things they've been doing and doing well since 1989. Who does this affect? There are approximately 10,000 LPC workers in Michigan who will lose their jobs, who will not be able to provide care because the 150,000 clients they have will not be able to afford it. Why will they not be able to afford it? Because LPCs, under the new regulatory rules, will not be able to bill insurance companies. They will not be eligible. I don't know how many of you use your insurance to pay for health care, to pay for your mental health care. I'm one of them, and 80% of my family is as well. I couldn't afford this without my insurance, and trust me, it's something I've needed very much, and probably something you need a great deal as well. To put this in perspective, 54% of the state's counties do not have enough mental health workers. You make this change right now, that number is going to change drastically. It's going to affect so many people beyond who it's affecting already. Well, the problem is it's regulations that were set up in 1989. It's 30 years later, guys. Let's update ourselves. Let's get ourselves in with the times. And LARA, that regulatory board, is ready to crack the whip. So what's being done about this? In 2018, last year, a bill was put before the House and the Senate to address this issue, to change some wording. And it passed the House. It did not pass the Senate. LARA is just sitting on this regulatory information, waiting for someone to do something, and they're just tired of waiting. And they have to enforce the rules. There's a new bill, and that's what I want us to focus on right here. It's House Bill 4325. House Bill 4325. This is currently before the Ways and Means Committee. It's already been passed by, let me just check my information here, passed by the House's Health Policy Committee. This needs to be voted on by our House and Senate right now. If the House and Senate can vote on this and approve of this bill, House Bill 4325, then that takes the pressure off of LARA to enforce the regulations. Again, LARA has a hearing, October 4th, this week, to address this issue. The clock is ticking, guys. What needs to happen? The LARA needs to hold their horses on the regulatory hearing. We need them to stand back and let the legislators do their job. Legislators, you need to do your job. You need to vote on this bill, House Bill 4325. There are 3 people in the Senate that I think need to be focused on, and if we can contact them, that would be great. These are Senator Vanderwall, and he is the chair of the Health Policy and Human Services Committee, Senator Lee Chatfield, and Majority Leader Mike Shirkey. I will also give information to contact the LARA prior to October 4th to encourage them, everyone please encourage them, to hold off making decisions about rewording this regulation that was made in 1989. So, I'm just trying to shoot this video off the cuff. I had some notes. We cannot have 150,000 people, additional people in the state of Michigan without mental health care. There are already so many without it. It's a very, very important issue. This treatment is very much needed by the community. We can't have 10,000 people that are needed in our community without jobs. We're not able to bill insurance companies. It's ridiculous. Please share this video with the people you care about. Please share this video with everybody. Please contact the House and Senate with the information I provide below. And also please contact the LARA division of the Michigan government and put that information below. Thank you so much personally for me. Thank you for reaching out and making a difference for those who struggle with mental illness in our community. I appreciate you all. God bless.